Okay, good morning, everyone. I'm Raul Macias, a voting rights attorney with the ACLU of California's Voting Rights Project. Thank you for joining us for our webinar on voter registration at Covered California. We're excited that you signed up to learn about the voter registration opportunity being offered to millions of Californians this fall when they apply for or renew their health care coverage. There's an impressive and diverse group of participants in today's webinar, including health advocacy groups, school districts, civic engagement organizations, community clinics, religious organizations, disability rights groups, and many others. You're calling in from every corner of the state. And welcome to the national organizations and folks from other states calling in today. California will be the first state to fully incorporate voter registration into its application and renewal processes when the second enrollment period launches this fall. And we hope our colleagues from around the country can help other states follow California's lead. The work to make voter registration possible at Covered California began nearly 3 years ago, and we're thankful to the James Irvine Foundation for its generous support of the ACLU's NVRA implementation project. Thanks to Senator Alex Padilla for authoring legislation in 2012 to get the ball rolling towards making Covered California a voter registration agency. Thanks to Secretary of State Deborah Bowen for being the first in the country to formally designate a health benefit exchange as a voter registration agency. And thanks to our staff for their leadership and hard work to ensure this opportunity would be available to Californians. And finally, we'd like to congratulate Covered California for all they have accomplished so far to make California a healthier state and for their hard work over the past 6 months to make voter registration a success this fall. Now we want to get a few logistical details out of the way. Please send us your questions in writing. On your control panel for this webinar, along the right-hand side of your screen, you will see a tab labeled Questions. Please type your questions into that box, and we'll do our best to answer them at the end of the presentation. And if there are questions we can't get to during the webinar, we'll do our best to try to answer those offline. If you have to jump off the webinar for some reason, we're recording it, and we're going to send out a link as soon as it's uploaded to our website. And now I'd like to introduce Jen Flory, a senior attorney at the Western Center on Law and Poverty, focusing on healthcare reform implementation for Medi-Cal and Covered California. In the Covered California world, Jen reviews proposed regulations and recommends changes to benefit California's low-income consumers. She also trains and provides technical assistance to legal services staff around the state, helping low-income consumers access Covered California plans and services, and reports back to Covered California staff regularly regarding barriers faced by consumers who are contacting legal services for help with Covered California applications. Jen is going to give an overview of how the second open enrollment period and renewals will work, and give us a context for the voter registration piece. So without further ado, I'm going to turn things over to Jen. And Jen, are you ready?
Yes. Can everybody hear me?
Well, they can't respond, but everyone
I guess Raul has to answer that. Hopefully you can hear me.
Yeah. All right, so slide one's queued up.
Okay, so let's go ahead and go to the next slide. Okay, this is what my portion is going to cover right now. I'm going to give just a big kind of high-level overview of open enrollment, how consumers can apply for Covered California, a couple of the things that have changed since last year, since although I think we did far better than the rest of the country, it was still a bit of a bumpy ride. And then finally, I'll give a bit of an overview of what's happening with the renewal process for people who already enrolled in Covered California. Okay, next slide. Okay, the first big takeaway is the date for open enrollment is different this year. Some cynical folks think it was moved because of the election, so it is starting on November 15th, and it will be going until February 15th. The other thing to note is that it is shorter this year, but hopefully, since many people did enroll last year, the demand might not be quite as high. Right now, people who have a qualifying life event, like they've lost their insurance or they've just had a child, something like that, they can still enroll through the special enrollment process, but before they're able to enroll in Covered California, they need to show what event it was that allows them to enroll. So starting November 15th, you need no reason. You can just, show up and decide you want insurance, and there's no question about how you were covered in the past or not. So some basics on open enrollment. If you enroll during the open enrollment period by December 15th, you will have coverage on January 1st, 2015. And then the way that the date works for when you are able to get your coverage, So it's always the 15th of the month is basically the cutoff. So if you enroll by January 15th and you choose your plan, you're able to then get coverage by February 1st. If you enroll by February 15th, you're able to then get your coverage by March 1st. Now, some clever folks have already asked me, if I enroll on the very first day of open enrollment, can I get coverage on December 1? No, our regulations are specific that you still won't get it till January 1. If you had a special enrollment period or a qualifying event or a special reason, you might be able to, but under the general open enrollment rules, no. Okay, let's go on to the next slide. The way that enrollment was designed was to be a no wrong door. Some of the ideas behind this was we wanted to make sure that people had many avenues for enrolling so they could use what was most comfortable to them. Some people are perfectly happy to take care of their own situation and handle it online. Other people want a bit more of walking through the process. And then we also understood that, a lot of people wouldn't necessarily know whether it was Medi-Cal or Covered California they were eligible for until they basically were entering their information and that information could be calculated for them. So the idea is also that wherever you apply, they're basically determining your eligibility for each program so that you don't have to figure that out ahead of time. So the basic ways are online, and that's either through the Covered California website or also where it says the SAWS portal. That is referring to the state automated welfare systems, and so those are the county-specific systems. Many counties have an online way that you can enroll. You can also enroll by phone, and that's either calling the Covered California Service Center or by calling your county social services office. You can send a paper application in by mail, either to Covered California or to your county human services department. Or you can go in person, and sorry I've used several different names for the county. It's basically the county Medi-Cal office. Some places they call it human services, some places they call it social services, some places they just call it the county Medi-Cal office. Or you can also go to a community assister, and that might be a certified enrollment counselor or a health insurance agent who can help you in person. So we'll go through each of these one by one. Let's go to the next slide. Okay, the first way is online. This is actually a picture of the website from last open enrollment because right now the website is just reflecting special enrollment. So it looks a little different right now. It'll probably look a little bit more like this starting during the open enrollment period. So there have been a series, for those of you that were working with the website before, you know that even though we didn't have the problems that the federal website had, we did have some glitches. So sometimes the website was down, and then there were also some problems that people had in kind of walking through the different elements of the website. There were a couple of questions that were asked that people had a hard time answering because of the way they were phrased. Some of that phrasing has been changed so that it is a bit more understandable by just a lay person. And then there were also, some areas where if you didn't enter a piece of information, you couldn't move on. So some of that has been changed. The website is still not perfect, so I don't, want people to think that we're going to have, no problems going forward. And there are definitely some programming issues that we're still working on to make sure that people, are correctly entering their income information. For some people, particularly people who are self-employed or who have a lot of changes in their income, it can be difficult to figure out the right way to enter your income. So while there have been some improvements made, some of these people may actually need more one-on-one assistance. So some of the pros of applying online are for people who are computer savvy, you can handle your own case, and then you have an online account, which is really what you'll be using for renewals and for reporting changes and things like that. Some of the cons about going online, as I mentioned, sometimes the site does crash, particularly during high volume times. It was really hard to kind of move page by page through the website. And also, if you don't understand something while you're looking at it, it can be hard to get questions answered so that you can actually complete the application process. Okay, let's go to the next slide on phone. So there are two ways to apply. If the most common way is to call the Covered California Service Center. When you go on to the Covered California webpage, the phone number is there. And I also want to point out that there are specific numbers you can get from websites. If you're helping people who are limited English proficient, there are numbers that they can call for, Spanish, for Korean, for basically the threshold languages that are used in California. So there are 3 service centers, and it doesn't matter which one you call, it'll get routed to wherever there's someone available. The service centers are open Monday through Friday, 8 to 6 p.m., and importantly for a lot of working Californians, Saturday from 8 to 5. Last year we had a lot of difficulty with waiting periods getting through on the phone, and in fact even currently there are some waiting issues, but for an entirely different reason. Covered California will be fully staffed up, and they are also expecting to hire an extra 250 contractors during the busy period. So some of the pros about using the phone is that you can get questions answered. Consumers who are limited English proficient can talk to someone in their language and, get some help with the application. Some of the cons are, if somebody has some really difficult questions, sometimes staff is not always fully up to speed on some of the more complex legal questions that might come up. And as well, if somebody, if it looks like they're really Medi-Cal eligible, if there's a special Medi-Cal program they might be eligible for, sometimes that can be difficult, as well as we anticipate there will be wait times again. Now, if you're working with people in your community and you know that they are Medi-Cal eligible, we would actually recommend that they call their county social services office. If they call Covered California, they will probably be routed there anyway. So just kind of a heads up on that. Although a lot of people, until you actually run through the income calculations, you're not sure where they land. So they should, just call the service center. Okay. The next one on applying by mail. Next slide. This is our single streamlined paper application. It is a rather long application, although it's the same information that's being asked online. But for some people, this is an easier way to deal with it because they can just look at it, and go back and ask questions. And so some of the pros of using that is, they can get help. They can go ask people to help them fill it out. Some of the cons is last year we did see some delays in processing for people that mailed it in. Or it can be difficult for them to report changes later if they haven't set up that online account. And then let's go to applying in person. This is the most hands-on, and you can apply in person either at your county social services Medi-Cal office, or you can use a community-based person such as a certified enrollment counselor. They are paid by Covered California or Medi-Cal, or you can also go to a certified insurance agent. I think for a lot of people, these are the people that have kind of the most hands-on training and can, basically get help when there's some sticky situations. One thing to be aware of is if they are applying in person, these people don't always set up an online account, so they may need to go and do that later, or have the person who's helping them show them how to do that so they can make changes later. If they don't have access to the internet, they can always go to like their certified enrollment counselor for some help in reporting those changes, or they can call back on the phone. Okay. So that's kind of the biggies of how you would apply. Let's go to the next slide. The other big thing that's going on at the exact same time as open enrollment is the renewal process. So renewals are actually starting earlier. The notices that people who are currently on Covered California will be getting are going to start going out in October. And they're trying to get everybody through the renewal process by December 15th so that their plan that they want is in place on January 1st when they're first eligible to use that plan. So let's go to the next slide and look at the timeline a little more carefully. So starting on October 6th, notices they're going to start going out on a rolling basis. So if you are helping someone and they don't have their notice and it's October 20th, that's okay. Some people, their notice won't actually be mailed out until the 30th because they're just, sending them out in batches so that the call centers aren't completely overwhelmed. And then there's a set of notices that's actually also going to start going out. And these are for people who they were eligible for those additional cost sharing subsidies, and they may not have chosen, the enhanced silver plan that gets them the best value for their money. So they'll be getting a special notice saying, there may be actually a better plan for you where you could get better value. And then there are a couple plans that are no longer going to be available. In the Contra Costa area, there is the Contra Costa Health Plan is leaving Covered California. Most of those people have already been notified and are already working through that process. It was a very small plan. And then there's a particular type of Health Net plan. Some of the PPO plans are actually changing to an EPO type plan. So people are going to get special notices about that if they're enrolled in that plan. And then starting November 1st, the health plans themselves will also send out renewal notices to their customers. So people will get a couple different notices saying, hey, it's time to renew. Now, the idea is that people need to renew themselves. And so they will pick, they can go back and look again. Some of the rates have changed. They may be able to find a better deal, or they may decide that they don't like their carrier and they would rather be with a different carrier so they can, say, access a different doctor, or they want to get into a different type of health plan. So they have opportunity to shop around and, decide if they want something different. If they don't shop around, Covered California is going to do everything that it can to try to make sure that they can keep people in Covered California and getting their tax credits as APTCs as long as they can. So if people have given authorization to Covered California to continue checking their income information against federal data sources, Covered California will just go ahead and use the data that it can find and then just keep people in their same plans using the new data if they don't otherwise do the renewal process. So for some people, they will just stay put. There might be a slight change in what their tax credit is, and then they'll get a notice about that. So where it says notice of eligibility for APTCs, that's the notice of the amount of tax credit that they're going to get, and then it will tell them basically, here's how much your plan premium would cost this year. Here's how much your tax credit is. Here's how much you'll have to pay every month. Now, for some people, if they didn't go through the renewal process, when they get that notice that tells them what they're going to be paying, that might actually prompt them to say, hey, I want to take a look, and I want to see if there's something that might be better for me. So as long as it's during that open enrollment period up to February 15th, they still can go and make changes if they decided that the plan they were either defaulted into isn't what they want, or if they, decide that they actually did need some more time to shop around, or they couldn't get the provider they wanted, or there was some other change in there. So even though their renewal process starts earlier, they can still use that whole open enrollment period. One thing that Covered California cannot do is put people into a different plan unless somebody actually says, hey, I want to change plans. They can't share information that you've given to Covered California and your current health plan with another health plan without your consent. So it is a bit of a complicated process on deciding how to put people into the right plan if they didn't actually choose what they wanted. But I think Covered California is doing about the best they can to compromise between giving people free choice and allowing them to do what they would like, and making sure that they actually retain those tax credits for people that don't act immediately. Now, for people who have not given consent to Covered California to Covered California to check their income information, if they don't renew, they're going to lose their tax credits. So they will probably act pretty fast when they get that first notice saying that all of a sudden their premium is a lot more. But it's important that people, know that they should participate in the renewal process, because if they haven't given consent to actually check their income information, they might end up paying quite a bit more than they're paying now. People have already gotten separate notices if they are people that didn't give consent. Let's go on to the next slide. Oh, I realized this is what I was talking about on auto renewal. I should have advanced the slide while talking about it. one other thing that I didn't mention on auto renewal is certain people who enrolled in a catastrophic plan, you can only enroll in that if you had a special exemption or you're under age 30. So if you've aged out and they're trying to auto renew you, they will just move you into a bronze plan. There are certain cases where they might do something else. The regulations kind of provide for how that works. And then for some people who are in what are called enhanced silver plans, they're people that are getting what are known as CSRs, or cost sharing reductions. And so based on their income, they might not be eligible for the same level of cost sharing reductions. And those are helps with paying their co-payments, paying their costs when they get care. So they will just be moved into the silver plan that they are eligible for. And then I think, let's see, some of the changes that we had there. You can still change your plan, like I said, until February 15th. One of the things that we do know, though, is a lot of people probably won't be reporting changes of income or other changes in their family until this renewal time comes on. So for those people, there will also, there might be another recalculation that's being made that would change what kind of tax credits they're getting. So even though there may have been an estimate that was sent to them initially with their renewal notice based on their current income, once they report what their income actually is, then they will probably have a different tax credit amount that they will be getting to help pay for their premiums. So, people will have a bit of readjusting that's happening in there. Okay, and then let's go on to the resources. So for those of you that like to get into the nitty-gritty, the regulations around renewals, around open enrollment, around all of that can be found at this website. It's basically the main health benefit exchange website. These regulations are eligibility and enrollment and appeals process, and they were just approved by the board last week. So some of the renewal regulations are brand new regulations, but they are available on the web. Now, if you're speaking to people in your community who need help with the renewal process, or who have tried to do something and something's gone wrong, or they're having difficulty with Covered California, the Health Consumer Alliance is an organization. Here's their 800 number that you can call, and they'll route you to your local legal services organization. They are contracted with Covered California to help Covered California with some of the trickier problems. So when people have complex income situations and they're not getting the right determination, or if somehow they lose access to their health plan or they are cut off of Covered California, this is who you call, because they can usually help assist consumers with those problems. All right, and I'll turn it back over to Raul so we can start talking about voting issues, and we can answer some of the higher level questions about this at the end.
Thanks, Jen. Hi, everyone. Again, my name is Raul Macias, and I'm a voting rights attorney with the ACLU of California. And before I start, I want to remind everyone that you can keep sending us questions under that, under the tab on your control panel labeled questions, and we're going to get to as many of those as we can at the end. And as I mentioned before, if there are questions we can't get to, we'll try to get everyone answers offline after the webinar. Okay, so I wanted to start by giving everyone some context about why we have voter registration at Covered California. And the basis for this is a federal law known as the National Voter Registration Act, or the NVRA for short. And this law requires public assistance agencies to provide voter registration opportunities, and that includes Medi-Cal offices, or offices that are receiving Medi-Cal applications. So all of those offices have to provide voter registration opportunities. On May 15th of last year, Secretary of State Bowen determined that the NVRA applied to Covered California and formally designated it as a voter registration agency. California was the first state to make that designation, but since then other states have followed. I wanted to give you all a bit more background on what's happened since that designation last May. So in May, the Secretary of State determined that this law applied to Covered California. But when Covered California launched in October, despite that designation, unfortunately voter registration was not provided to applicants. So in March of 2014, The ACLU, DEMOS, and Project Vote sent Covered California a notice of noncompliance with the law, and that triggered a 30-day period for them to comply with the NVRA or to potentially face a lawsuit. This action was brought on behalf of several individuals, as well as the California League of Women Voters and the Young Invincibles. And a few weeks after that, we reached a settlement agreement with Covered California and the Secretary of State to bring Covered California into full compliance with federal and state voter registration laws. So by May of 2014, Covered California, as part of the settlement agreement, had completed a remedial mailing of voter registration cards to over 2.6 million households, and these are all households who had applied during the initial open enrollment period. That mailing was translated into 12 languages. And since then, Covered California has continued to mail voter registration cards to everyone who applies, and they're going to continue to do that until they're fully compliant. And that brings us to the open enrollment period this November, when we expect Covered California to be fully compliant with voting rights laws. So there are 3 times when voter registration must be provided to consumers. So it's going to be included with each application, at the time of every renewal or recertification, and every time a beneficiary notifies Covered California that they have changed their address. And this applies to all transactions, whether those transactions occur online or whether they're made with a paper application by mail, or if it occurs in person or over the phone. And I also want to point out that consumers are going to receive this opportunity regardless of what they're eligible for. So whether or not they're ultimately determined eligible for Medi-Cal or Covered California or not eligible for any program, they're still going to receive the opportunity to register to vote. And so the first type of transaction we're going to talk about is in-person transactions. So in-person transactions are going to, or voter registration services are going to be provided by certified enrollment counselors, navigators, certified insurance agents, or at county welfare offices or county Medi-Cal offices. These offices are required to provide the same degree of assistance or the same level of assistance with voter registration as they would with Covered California's forms. So just like assisters are going to be checking forms to make sure that they're complete and they're going to be answering basic questions about health insurance, they also have to provide that same level of assistance with voter registration. And then the only exception to this is going to be plan-based enrollers. So the consumers that are applying with plan-based enrollers are going to be mailed voter registration materials, and that's going to include contact information for the Secretary of State so that those consumers can still get assistance with any voter registration questions they have. To prepare assisters for this new responsibility, Covered California has prepared materials and a voter registration training module. So as part of the computer-based training that assisters are receiving, there's now going to be information on voter registration. Covered California is also planning an additional webinar training that I believe we're going to be participating in and the Secretary of State will be participating in. So this is an additional optional training for all of these assisters. And again, the goal of this is that all of these folks are going to be prepared to provide the same level of assistance with voter registration as they do with a Covered California application. So, the first page, or the first type of transaction I want to show you is, so this is the online application for, this is the online voter registration screen that consumers are going to see. This screen is going to appear before consumers receive their eligibility determination. So after they've entered their personal information and income information, but before that determination is made, they're going to get to this page with voter registration information. The voter registration page asks the question, if you're not registered to vote where you live now, would you like to apply to register to vote today? If a consumer is applying in person with an assister, the assister is actually required to read that question. And the consumer then has the choice to register online, receive a voter registration card in the mail, or to not register at all. Next, you'll see a note, and what that says is that if a consumer does not choose one of the answers above, then that consumer will be mailed a voter registration card. This is included because a consumer can hit continue on this page without making one of those selections. And the last portion of the form is a listing of certain rights. And again, if the consumer is applying in person, the assessor is required to read these notices or to give that consumer a chance to read those notices. And I wanted to highlight the first two, a couple things in the first two notices. So first, the first notice lets the consumer know that the application or their decision whether or not to register to vote will not affect the amount of assistance that's going to be provided by Covered California. So in other words, registering to vote is not a condition of application. And the next notice lets the consumer know that they have the right to apply in private if they want to. And so the assessors are going to be instructed that they have to give consumers that opportunity. So next we have a screenshot of the Secretary of State's online voter registration page. And this is where consumers will land if they decide to register to vote. This page will open in a new window, and Covered California has actually been assigned a unique URL so that the Secretary of State can track the number of registrations that come from Covered California applicants. Online registration underwent a redesign this year to make it much more user-friendly and accessible. And the redesign also made Covered California available in additional languages. And so I pointed those out there. There isn't a perfect overlap with the languages that the Covered California application is available in, but it's still a great opportunity to offer consumers to apply in their preferred language. And I also wanted to highlight for you another feature of online voter registration, and that is that consumers can use this system even if they don't have a state ID or a social security number. So next I wanted to cover phone transactions. Consumers applying by phone are all going to be mailed voter registration cards along with a letter explaining where they can get help registering to vote. That letter is available in 12 languages and will be mailed based on the preference that the consumer indicated when they applied. So the language preference, excuse me. And again, assistance is available by phone for consumers or assistants who have voter registration questions. You can either contact your county elections office or the Secretary of State. So here we can see the paper application, and this is going to be where the voter registration information appears in the paper application. It's going to be right above the signature page of the application. And I wanted to point out a couple things that are a little bit different about this than the online voter registration page. So the first is the consumers have the option to have a voter registration card mailed to them. However, as you're going to see, if the consumer is applying with a paper application with the help of an assister, and if internet is available, they're actually going to be given the option to still register to vote online, even if they're applying with a paper application. And so that's that second option. If a consumer is applying on their own, they might choose this second option to just go online to register to vote. But if the consumer is applying with an assister and internet is available at the time of application, the assister is going to be instructed to take the applicant to the Covered California website where there's a voter registration page. The instructions for assisters are a little bit more clear, and this might sound a little confusing, but the reason that they're going to the Covered California website instead of directly to the voter registration page is that the registrations from the Covered California website are going to be tracked, again, so that the Secretary of State knows how many applications are coming from Covered California. And lastly, just like when a consumer applies online, if they don't select an option, they're going to be mailed a voter registration card and an accompanying letter. So I wanted to point out one way that renewals are going to work a little bit differently from new applications. Consumers who are renewing online, in person, or by phone will receive voter registration as part of that process, just in the ways that I've already described. But for consumers who do not log on during open enrollment process, and Janet described these consumers earlier, if consumers who don't log on during that period, they're going to be, the people who are automatically renewed by Covered California are going to be mailed a voter registration card and an accompanying letter. And that notice is actually going to be separate from any notice they receive from Covered California. It'll be a mailing dedicated just to voter registration. So lastly, I want to give you a few resources. And first, here's my email address. And I hope that we're going to try to answer a lot of questions, but please let us know if you have additional questions after the webinar, or if you're encountering problems with how this voter registration process is working. This is new, and we really want to know how this is working, and get your feedback on how this actually works in practice. And if we get that information, we'll do our best to bring it to the attention of Covered California. Another good resource for assisters is going to be the task guide that's been prepared for assisters. This is going to be included as part of their training, and it includes the screenshots they need so they're familiar with this process, and an FAQ about voter registration. The ACLU has also prepared a toolkit that includes fact sheets for NVRA agencies, and you can find that from that link, or if you can't find it, feel free to email us. The ACLU also has a website with information on voting rights of formerly incarcerated individuals. That's letmevotca.org. And the Secretary of State has a website with information for voters and for NVRA agencies, and that's at sos.ca.gov. And with that, I think we're ready to open it up for questions. So first we have some questions for Jen, and we received quite a few questions for Jen, and so we're going to try to get to some of those offline. But the first question is, Jen, how will CalHERS work when someone is deemed Medi-Cal eligible? Last time the screen just said congrats and referred everyone to DHS, and that was confusing.
Yes, this is still what is going to be happening to you. It tells you that it looks like you are Medi-Cal eligible, and then the case is then transferred over to the county for a final Medi-Cal eligibility determination. This is an area where we still have concerns, and that many people may have heard that there still is a Medi-Cal backlog. Many of the problems that caused that have been resolved, so we're hoping that it goes more smoothly this time, but those people, they are ultimately transferred to the county. That's why earlier I had said, for some people that are Medi-Cal eligible, sometimes it is easier to just start your application with the county.
Okay, thanks. And the next question, Jen, does recertification have to be completed before a certified enrollment counselor can provide renewal assistance?
That I do not know, since I'm not working with certified enrollment counselors in particular on their certification process.
Okay, if someone applies now due to a qualifying event, do they have to renew in November?
Yes, they will likely, because the period of time that you're qualifying for now is for the 2014 coverage year, so you will then need to renew again for 2015, although, in all likelihood, you may have no changes to report. And also, because the plan rates change in 2015, that's another reason that you'll need to renew. If your plan has changed significantly one way or another, you might decide that you want something else.
Okay, so we got a lot of questions. There seems to be a lot of confusion over the renewal and application deadlines, but maybe we'll let Jen follow up with people directly about those.
Okay.
And we can also send it, maybe we can just create a timeline to send to folks.
Yeah.
Yeah. So the first question about, on voter registration is how many people have registered to vote as a result of the remedial mailing? We're getting some noise on there. Jen, I don't know if that's your line.
Mine's muted.
Just a second. Okay, we got it. So the next question is, how many people have registered to vote as a result of the remedial mailing? The remedial mailing resulted in the first 3 months in approximately about 27,000 voter registrations, and that number is, Covered California is still conducting this remedial mailing each month, so we only have data right now through July. The next question is asking for clarification regarding in-person registration. So is it an online form or a paper form? So that's a good question. So consumers, so applying in person can potentially could use an I think most consumers will be applying online, but some might also use paper applications. For example, the online application is only available in English and Spanish, and so if a consumer wanted to apply in another language, the paper application is available in 10 additional languages. So in that case, the consumer might be applying with a paper application, even if they're applying in person. And the way, and I'll just go over this one more time. So if a consumer is applying in person and is using a paper application, the assister is going to be instructed to, if internet is available, to still take that consumer online to give them an opportunity to register to vote in person and receive assistance right there online. If internet is not available and they're using a paper application, and if that consumer wants to register to vote, they're going to select the option to have the consumer be mailed a voter registration card. But otherwise, I think Covered California expects most consumers to receive, if they're being assisted in person, to apply online. The next question is whether certified enrollment counselors carry voter registration cards with them if they know how to register people with paper cards. So enrollment counselors are being instructed to take advantage of online voter registration. The online application is going to link consumers directly to online voter registration. This has a number of benefits, and one is that you can take consumers online, and it's available in 10 different. The application is available in 10 different languages. It's fast and easy to use, and has been shown to improve the completion rate and the accuracy of the registration. So enrollment counselors aren't being instructed to use paper voter registration cards. They're really being encouraged to use the online system, and if consumers don't want to register at that time with online registration, they can just select the option to be mailed a voter registration card. The next question is whether navigators will be trained and given what they need to do voter registration. So navigators will receive training just like other enrollment counselors on voter registration. This is going to be part of the training for enrollment counselors that are renewing, so folks who did this last year, as well as enrollment counselors or people who are applying to be enrollment counselors or navigators for the first time. There's going to be training included in all of that. There's also a pretty comprehensive task guide, so materials that all enrollment counselors will receive that walks them through how these different transactions work. It includes a frequently asked questions section so that that assisters have a page to reference to answer some questions for consumers. There's also going to be an additional webinar that I mentioned that Covered California is going to host. And ultimately, if an enrollment counselor is helping a consumer, we don't expect people to be voting law experts. So if you have questions, you have the Secretary of State's phone number as a resource, and you can also contact your county elections office to help you answer questions. We have another question about how are sisters being trained to answer questions about filling out a voter registration application, such as how to choose political party preference. That's also going to be part of the training. But just to give you a brief answer, that enrollment counselors are going to be specifically instructed not to answer questions about political party preference. That's part of the federal law that says they're not to discuss politics with the applicant. I have another question. When will the online voter registration be available on CalHERS? As far as we know, it's going to go live on the preliminary date that we know is October 6th, but we'll be sure to let people know when it is live. And right now, it's also undergoing some testing from accessibility experts to make sure that when consumers want to register to vote, that when the new window opens to the Secretary of State's online voter registration page, that link is going to work in a way that's accessible for people using screen readers and other accessibility tools. Okay, I have another question here. It says, what happens if a consumer doesn't register to vote on CalHERS and registers through a tool like the RTV tool instead? So, and I'm sorry, that's the Rock the Vote tool. So this would be if an organization wanted to use a tool where they could register a consumer to vote, but through a tool where they can collect certain information from the consumer so that they can follow up with that consumer about the election and let them know when an election is coming. So if a consumer isn't taken to the online voter registration page from CalHERS, then that registration isn't going to be tracked by the Secretary of State's office. But otherwise, it essentially works the same. They're still going to be registered to vote. They're still going to end up on the Secretary of State's website where they can fill this out. And actually, let me see if I can open this up to Mark Weatherhorn, just because I know he's done some work with community health clinics on using sort of this model. So give me just a moment. Mark, I've opened up your phone line. Are you there?
I'm here.
Can you introduce yourself briefly and just maybe if you have any other comments about this?
Sure. I'm Mark Weatherhorn. I'm the project director for Community Health Vote, which is a project of federally qualified health centers that's been going on for a while, and we, along with a number of organizations, are using the Rock the Vote tool in an effort to try to not just register the patients and clients or folks who come into health centers, but also to be able to offer them the opportunity to get reminders or information about elections. And the key for us is we want them registered, but we also want them to vote. So what we've been asking our folks to do is when this question comes up, and it's actually been on the federal forum, it just hasn't been any way to go online and do it, is to basically, if they say yes, to use the Rock the Vote tool to register them to vote. And if it's not online, they have to print out the form, sign it, and turn it in just like a paper form. The only issue here is obviously that we would like our centers in California to do this, but again, the Secretary of State doesn't capture the information that's coming from covered California, so we still have to figure out how that's going to work. But we think, an online link through the Rock the Vote site takes people to the Secretary of State site. There's just that intervening step, which actually pre-populates the Secretary of State's form for the information they've already put in. So I guess we're still trying to figure out, how that works and if it's okay from a NVRA standpoint, but certainly from a practical standpoint, it works just fine for the health centers and their patients.
Okay, thank you, Mark.
Yeah.
And so, Mark, if people had additional questions about that, do you want to share your email address?
Sure. They can email me at mweatherhorn, that's MWETHERHORN @communityhealthvote.net. And I'm glad to give people my phone number too. It's 540-942-3862.
Okay, thank you.
Sure.
So the next question, someone had asked if I can clarify the voter registration process for renewals. So I'm happy to do that. So when consumers receive their notice that the second open enrollment period has started, consumers, if they seek in-person assistance or log on online to re-enroll themselves or contact Covered California by phone, they're going to receive voter registration services the same as any new applicant. Now, the only difference is if this is for the folks that Jen described earlier, if they do not receive, if they do not log on during that during that time and renew themselves, Covered California is going to automatically renew some of those people, and once that's done, Covered California will separately send a voter registration notice and a letter explaining where they can receive assistance with voter registration. And Jen, maybe it would be helpful, because I know we've gotten some more questions about renewals. Do you mind describing the process one more time for what happens if folks don't respond when they get the notice of renewal?
Sure. So people, they'll be getting their notices of renewal rolling out in October. They'll have 30 days to respond. If they don't respond, then Covered California is basically going to be taking each of their cases and seeing what they can do to keep them in their plan. If they have consent to verify their income, they'll just keep them in their plan and apply the tax credits based on what their current income has been verified as. If they don't have consent based on their income, they will basically keep them in their plan, but they will lose their tax credits until they, contact Covered California somehow to tell them what their income is. And then if they can't keep them in their same plan because there's something about the eligibility for that plan, they'll try to keep them in another plan of the same carrier. And then, I understand there were some questions about timeline. So basically, they have 30 days after they get that notice for them to self-select. If not, Covered California will try to make a decision for them. But if they don't agree with that decision, they have throughout the open enrollment period to change what plan they are in. The two dates to keep in mind for kind of when things become active, they need to have, if they sort out everything before December 14th, December 15th, up and through December 15th, and whether that was through themselves or some auto-renewal process happened or they then contacted Covered California, all their changes will go into effect January 1st, 2015 when the new plan year starts. If it happens after that, but by February 15th, they're still within the open enrollment period, so they can still make those changes. So they may, switch out of a plan from January to February, but they're still within open enrollment. So the big dates to keep in mind are December 15th for your January 1st coverage, that's the new plan year, and then February 15th is the last day to make any changes.
Thanks, Jen. I hope that was helpful for everyone. We have one more question on whether this is going to be confusing for people who are already registered to vote. So we've done our best in the letters that are going out to consumers to let them know that that Covered California hasn't has not checked voter registration records before they've sent this notice, that it's just going out to everyone and it's up to the consumer to whether or not they want to register to vote or not. The in-person assisters are also receiving training on when to help them answer questions from consumers on whether or not they on when people need to register to vote, including if you've moved or if you've changed your name, if you haven't voted in a long time. So assisters are being trained to answer these questions. But lastly, if a consumer happens to register to vote and they're already registered, there's not any consequence of that. So there's no harm if someone happens to register again. Yeah, and then I should also mention that the language on CalHERS tries to point that out. That I'm sorry, on the Covered California online application, it should point out that Covered California hasn't checked that person's eligibility, or I'm sorry, that person's voter registration status. So with that, we're getting towards the end of time. I want to let everyone know we've recorded this webinar, and so we're going to be sending that out. If you know anyone who wasn't able to attend but wants this information, you can share it with them. Or if there was a part that you missed, you can see that once we email that out. We're also going to include our contact information and some of the resources that we've spoken about. So thank you everyone again for joining us. Thank you Jen Flory for your presentation. And as I mentioned earlier, please let us know how this is going. And this is the first year that this is taking place, and we're really excited about it. And we want it to succeed. So thank you all again, and have a great day.